my name is Alia Parker, and today I'm going to be doing a head, ear, eyes, nose, and throat assessment on this gentleman here. What's your name and date of birth?
Anthony Parker, 2/12/72.
Okay, and is it okay if I assess you?
It is.
Alright, so I'm going to be doing a general inspection, and I'm going to be looking at the temperature, level of moisture. I'm going to be checking to see if the skin has any breakdown. I'm going to go ahead and assess your skin turgor by taking the hand, tinting it up, and it should spring back just like that, so that's perfect. I'm going to be looking at his hair, and I'm going to be slightly tugging to see if any hair comes out easily, if it's falling out. I'm also going to take note of the cleanliness of the hair. Then I'm going to move to assessing his nails. I'm going to assess texture, temperature, redness, and capillary refill. Great. And then I'm going to be palpating his head and scalp, and I'm going to be checking for any nodules or lesions. Great, so nothing was there, that's great. Then I'm going to gently palpate over his joint, checking for TMJ. No swelling. I'm going to ask him to open his mouth wide. Do you have any pain when you do that?
No.
Okay, you can shut your mouth. Thank you. Thank you for that. Then I'm going to use my thumbs to gently assess his sinuses. I'm going to be feeling around here at the top of the sinuses, in a circular motion underneath the sinuses, checking for any tenderness or swelling. Did you have any tenderness with that?
No.
Great. Then I'm going to be palpating his temporal arteries and checking his veins. That's going to be just in front of his tragus, midline to the jawbone. I'm also going to auscultate. When I'm auscultating, I'm listening for any bruits or any adventitious sounds. Great, there's none. And then I'm going to move to palpating and filling his trachea. Can you slightly put your head back? Perfect. And I'm checking to make sure that trachea is midline and there's no deviation. And I'm also checking the thyroid gland to see if there's any enlargement, nodules, or goiters. Thank you, it's perfect. Then I'm going to move over to his lymph nodes, and I'm going to start with the pre-auricular lymph nodes and then the post-auricular lymph nodes. And while I'm doing this, I'm feeling for any swollen or tenderness. The superficial cervical, deep cervical chain, posterior cervical, tonsillar, submental, submandibular, and supraclavicular. Go ahead and check there. I don't feel any swollen lumps or nodules. Did you have any tenderness with that?
No.
Great. Now I'm going to move to his eyes. I'm going to be inspecting his eyelashes, making sure that they are symmetrical and that they slightly curve outward. And I'm going to ask you to open your eyes really wide and then shut them tight. And I'm taking note of any drooping and to make sure that they are even. I'm going to be inspecting his eyelids for any nodules, any swelling, redness, or discharge. And at the same time, I'm going to also ask him to open his eyes and check his lacrimal glands to make sure that they are not swollen or extra discharge, and looking at his conjunctiva to make sure that it's nice and pink. And it is. I'm going to go ahead and be looking at his whole orbital bone structure to make sure that there's no bruising, swelling, redness, or tenderness, or deformity. And then I'm going to get my ophthalmoscope, and I'm going to be looking to make sure that he has direct and consensual response in his pupils. So go ahead and open your eyes wide. I'm going to shine a light in your eyes. Are you ready? Set. The left one constricts. The right one constricts. And then I'm going to be checking to make sure that the right one constricts while the light is in the left and vice versa. Great. And they do, so that's good. And then I'm going to move over to his ears, and I'm going to be checking the general appearance, color, size, shape, and symmetry. While I'm doing that, I'm going to be palpating and asking, do you have any tenderness when I touch the lobes of your ears or anywhere around the ear? Do you have any tenderness?
No.
Okay, I'm going to get my otoscope. I'm gonna be checking the tympanic membrane. It should be pearly or pink grayish looking. And while I'm doing that, I'm also gonna be looking for the integrity of the tympanic membrane. Make sure that there's no perforations. Visualize the parts of the ear, like the malleus and the incus and the pars tensa, and make sure that all those structures are visible, and check for any extra fluid. Good. On this side. Good. Did you have any pain or tenderness with that?
No.
Okay. So next I'm going to go ahead and move to his nose. I'm going to inspect for overall shape and symmetry. I'm going to make note of any kind of edema or lesions or irregularities, which there are not. I'm going to gently palpate his sinuses, make sure that there's no puffiness or swelling. Is there any tenderness when I do that?
No.
I'm going to check also, looking to see if there's any kind of discharge coming from the nose. And then I'm going to get my otoscope and check the nasal cavity. When I check the nasal cavity, I'm going to be checking for edema. I'm going to be checking for any masses, any lesions. Make sure that you have septum continuity and any discharge. If you'll lay your head back a little bit, thank you. All right, other side. Good. Did you have any pain or tenderness with any of that?
No.
Okay, and I saw no kind of polyps, masses, or lesions. Now I'm going to move to his mouth. I'm going to be taking note of his lips, the moisture, any cracking. I'm going to be looking to make sure that they are symmetrical, that there's no edema. I'm going to ask him to open his mouth and kind of smile for me, like this. And I'm looking at his teeth. I'm looking for overall dental hygiene, how many teeth he's missing, how many teeth he has, looking for anything unusual. While I'm looking at his tongue, stick your tongue out. I want to make sure that it's midline. I want to note color and moisture, make sure that it is moist and it is pink. And then I'm going to go ahead and check his buccal mucosa. And by doing that, I'm going to use my pen light. I'm going to ask him to open his mouth, open your mouth, and lift your tongue up. And I'm going to be looking at the floor of the mouth, making sure that there's no kind of lesions. I'm going to take note of all the vessels in there and make sure that there's no masses or anything else like that, making sure that it's moist. Yep. And that is it. Thank you. That is my head, ears, eyes, nose, and throat assessment. Thank you to Mr. Parker. Did you have a good time?
I did.